How does anesthesia impact surgical risks in plastic surgery? When considering plastic surgery, a common question arises. How does anesthesia impact surgical risks? Anesthesia is essential for allowing patients to undergo procedures painlessly. However, it also brings specific risks that can affect the safety of the surgery. Anesthesia involves using medications to create a temporary loss of sensation or consciousness. In plastic surgery, there are two main types: general anesthesia, where the patient is fully unconscious, and local or regional anesthesia, which numbs a specific area. The choice depends on the complexity of the procedure. One significant risk associated with anesthesia is cardiopulmonary complications. Anesthesia can affect the heart and lungs, leading to issues like changes in blood pressure or heart rhythm disturbances. This risk is particularly heightened for patients with existing heart or lung conditions. Another concern is the potential for blood clots, known as deep vein thrombosis. The immobility during surgery, combined with anesthesia, can increase the likelihood of clots forming in the veins. If these clots travel to the lungs, they can cause a serious condition called pulmonary embolism. Bleeding is another risk during surgery. Anesthesia can affect how blood vessels react and how well they clot. This can increase the risk of bleeding during or after the procedure, which may lead to hematoma formation. Nerve damage is also a possibility. Some anesthetic techniques can irritate or damage nerves, resulting in temporary or, in rare cases, permanent sensory changes. Allergic reactions to anesthetic agents, while rare, can occur. Patients may also experience toxicity if dosages are not carefully monitored. Postoperative nausea and vomiting are common side effects of anesthesia that can impact recovery. To mitigate these risks, thorough preoperative assessments are crucial. Evaluating a patient's medical history, including any heart, lung, or metabolic conditions, helps identify potential anesthesia risks. Anesthesia plans should be customized to each individual and their specific procedure to minimize complications. Continuous monitoring of vital signs during surgery is essential for early detection of any adverse events. Patients should also prepare adequately before surgery. This may include undergoing tests to ensure they are fit for anesthesia and following specific instructions to reduce risks, such as fasting or adjusting medications. Certain aesthetic procedures, like eyelid surgery or breast reconstruction, may carry higher anesthesia-related risks due to their complexity. Minimally invasive procedures often use local anesthesia, which reduces systemic risks but still requires careful management. It is advisable for patients to schedule consultations well in advance of their surgery. This allows for necessary evaluations and planning. Being aware of the risks associated with anesthesia promotes informed consent and helps set realistic expectations about recovery and potential complications. In summary, while anesthesia is crucial in plastic surgery, it does introduce risks related to cardiopulmonary function, bleeding, clotting, nerve effects, and allergic reactions. Careful evaluation, personalized anesthesia management, and vigilant monitoring are key to minimizing these risks and ensuring patient safety and optimal outcomes.